Every single day, over 35 million people around the world swallow one tiny white pill, believing it's keeping their heart safe. But what if the medicine that's supposed to protect you could quietly fail to work at all? This month, over 140,000 bottles of one of the world's most common cholesterol drugs, Atorvastatin, were recalled. And if you're over 50 and take cholesterol medication, this story matters to you. In late September 2025, the US FDA announced a nationwide recall of Atorvastatin calcium tablets made by Ascend Laboratories and Alchem Labs India. The reason? These pills failed dissolution tests, meaning they might not dissolve properly in the body. And if they don't dissolve, they can't deliver the right amount of medication to lower cholesterol effectively. The recall affects 10 milligrams, 20 milligrams, 40 milligrams, and 80 milligrams tablets, with expiration dates through early 2027. For seniors, statins like Atorvastatin are more than just pills. They're lifelines. These drugs help lower LDL, the so-called bad cholesterol, and protect against heart attacks and strokes. But when a tablet doesn't dissolve as it should, your body absorbs less medication. Over time, that means your cholesterol could silently rise, even when you're taking your medicine faithfully. That's the hidden risk this recall points to. Not contamination, but ineffectiveness. It's not about poisoning the body. It's about failing to protect it. The FDA calls this a Class 2 recall. That means the health risk is considered temporary or medically reversible. In other words, no one's in immediate danger. But if the medication doesn't dissolve correctly, it could fail to do its job. As of now, there have been no reported injuries or hospitalizations. The biggest concern? Reduced protection against heart disease, especially for older adults managing blood pressure, diabetes, or prior cardiac events. Here's what you can do right now. Step 1. Check your pill bottle. If it says Ascend Laboratories or Alchem Laboratories India, and the strength is 10, 20, 40, or 80 milligrams, take note of the lot number and expiry date. Step 2. Call or visit your pharmacist. Ask, is my batch affected by the September 2025 recall? Step 3. Don't stop taking your medication without speaking to your doctor. Suddenly stopping statins can cause a rebound rise in cholesterol, or worse, trigger a cardiac event. Your doctor may simply switch you to another brand or adjust your dose. Drug recalls aren't rare, but they remind us how fragile trust in medication quality can be. This recall isn't about panic, it's about awareness. Seniors often take 5 or more prescriptions daily, but how many people actually know where those drugs are made, or whether they've ever been recalled? The truth is, recalls like this highlight the importance of pharmacovigilance. Staying informed, asking questions, and never assuming your medicine is flawless. That's why Agewell exists, to translate medical noise into clarity, so you can live confidently, not fearfully. Even if your medicine was affected, this is not the end of the story. It's a reminder to stay proactive. Keep regular checkups. Ask your pharmacist where your medications come from. Stay consistent with your healthy routines, balanced diet, light exercise, stress management, and enough sleep. Because your long-term health is built on daily habits, just as much as it is on prescriptions. So, if you've ever wondered, am I really safe with the pills I take? The answer is, you can be, as long as you stay informed. And that's exactly what we're here for. Age well, live smart, live strong, live long.